Okay, I just hear that my name was mentioned again by Carleton-Victoria MLA Margaret Johnson. Don't know if I met her or not, but anyway, uh, my God, Pam Lynch was the first one years ago. Then David Cohn. Oh, and then Michelle Comroy in the back, and now Margaret Johnson. And it's funny because, not funny, but sad that me and so called doctor Sara Davidson are mentioned in the same phrase. Listen to this.
Why should New Brunswick be considered immune? Oversight is not about punishment or suspicion. It's about prevention. It ensures that our good intentions do not become someone else's nightmare. Nowhere is the need for oversight more evident than in private methadone clinics. Across our province, these clinics are often where we see individuals loitering outside buildings, visibly high, waiting for their next dose. And patients may receive the same dose a day after day without the wraparound supports needed to break the cycle of addiction. This perpetuates that toxic cycle, repeated highs, withdrawal, and repeated exposure to the streets and unsafe environments. So this is not just a problem for patients, it impacts communities. When private clinics operate without rigorous oversight, public safety is compromised. Streets become unsafe, patients remain trapped in a cycle of dependency. To maintain public confidence, provincial oversight must ensure that every clinic, public or private, must adhere to the same high standard of care. Real-time prescription monitoring, adherence to dosing best practices, integration with mental health services, and coordination with housing and social supports. Only then can MAT be a true path to recovery, not just a daily dose. We've seen similar concerns right here in this province. In Fredericton, the Riverstone Recovery Centre has been at the centre of public debate. Some downtown residents and business owners have voiced worries about rising crime and disorder in surrounding areas. To be fair, the centre's operator, Dr. Sara Davidson, has denied that her clinic is directly responsible for any increase in criminal activity. Yet even she told CBC News that providing a safe supply is just part of the solution. We've heard from our blogger friend Charles LeBlanc how bad that situation is. She's emphasized that additional supports, including mental health services and stable housing, are essential to help people truly turn their lives around. And that, Madam Speaker, is precisely the point. Even those delivering these services recognize that medication alone cannot solve addiction. Recovery is not simply about substituting one drug for another. It's about rebuilding lives with stable housing, therapy, community connections, and a sense of purpose. The need for wraparound services is essential, and I will be speaking to that in another motion later. Compassion is abundant among healthcare workers, addiction counselors, and recovery advocates. They're doing heroic work, often under immense pressure and with limited resources. But compassion must be matched with competence and accountability, with a system that monitors outcomes, tracks prescriptions, prevents diversion, and ensures continuity of care.
You see, the problem is, it sounds good. Oh, by the way, thank you very much, Margaret Johnson, mentioning my name. That's good to be acknowledged. But the problem is, it don't matter each province in Canada. The opposition, they say blah, blah, blah. And once they get in power, the bureaucrat says, this is how much it costs. What do you want to do? You want to cut the seniors' pension, or sorry, you can't cut seniors' pension. But you want to cut raise the price of NB Power, let's just say. Just an example. And then they'll say, oh, we can't do that. Well, where are we going to get the money to pay all this? This is a national issue. The government, the federal government, got to get involved in this for every province. It's really, I don't know what's going to happen in 50 years from now. Really, it's going to be really, really, really bad.